Hi, this is Jessica DeMassa with the Guidewell Insights Lounge. I'm here at Singularity University's Exponential Medicine, and I am joined with Griffin Mulcahey, and Griffin is the COO and co-founder of Med2U. So why don't you start out, first of all, welcome, and why don't you start out by telling us a little bit about Med2U?
Sure. Med2U is a preventative care and mental health service, bringing the right care at the right time for the right reasons with value-based on-site care.
Okay, so go a little bit deeper for me. So is this like a patient portal? What is this?
Sure. No, we utilize nurse practitioners, registered dietitians, social workers, psychologists, all supervised by physicians to bring preventative care, wellness, and most important, we think, is mental health care, which should be a part of primary care, breaking down the silo to patients where they need it most.
Okay, so how do you guys do that? What kind of technologies are you using to reach patients?
So we're kind of a low-tech solution that utilizes a lot of high-tech services.
Okay.
So telemedicine, all our physicians follow up and supervise the team approach via telemedicine. We use remote patient monitoring, diagnostic tools, really whatever works best for our providers and they find engages best with the patients, that's what we utilize.
Okay, cool. And I'm really interested about this mental health aspect that you're bringing into play here. So how are you guys integrating the mental health treatment?
So when we offer our services, we say mental health is part of it. We do, just like you see your PCP, your primary care provider, I think everyone should have a point of entry to a mental health provider.
Why is that?
Well, behavior change, behavior modification, emotional wellness, these are all the things that we've been overlooking for 100 years in healthcare, and it's becoming clear that's the driving factor. You don't end diabetes until you end a person's lifestyle choices. Depression is a leading cause of absenteeism, presenteeism issues in the workforce. All that is tied into play with healthcare. So we think no more preventative care, primary and mental health, all one care.
So how do we use technology to make healthcare more inclusive for patients and really bring them in and take care of them in this more holistic way that you're talking about?
Sure. I think engagement is a lot easier with technology, both in the frequency you can engage with your patients.
Sure.
Say you see them in person, but then you have a medication management visit, say 2 weeks later via telemedicine. In remote patient monitoring situations, we utilize texting, reminders, case managers to coach the patients, to help with those day-to-day decision making.
So of the technologies that we've been talking about here at xMed, there's a lot of talk about all sorts of different exponential technologies in particular, especially data and robotics, 3D printing, those kinds of things.
Right.
What has you most excited for the future of healthcare?
There's a lot to be excited about. And I think the biggest driving forces is figuring out how we utilize those to impact a behavioral change. Earlier today, saw the presentation by Iodine with their, assessing whether or not an antidepressant actually works. I think those kind of things where you work with the patient to say, maybe we change the medication 2 weeks later instead of 3 months down the road if it's not working for you. I think whatever can engage and drive behavioral change with the adaptation of technology and traditional healthcare delivery is the future.
Excellent. Well, thank you so much for joining us here in the Insights Lounge. It's a pleasure to hear from you, and we'll definitely take a look at your app and see a little bit more about how you guys are using these technologies to engage patients. So again, it was Med2U, right?
Yes.
Excellent.
Thank you, Jessica.
No problem. I'm Jessica DeMassa in the Guidewell Insights Lounge here at Singularity University's Exponential Medicine. Thanks.